We shall take up general diagnosis of face, red complexion, white complexion. There are two aspects to observe when conducting face reading: the color radiance and physical form. Complexion is likened to a thermometer that helps one understand his or her health status. By observing the changes in the color and radiance of one's facial skin, one can tell whether the Zhang and Fu organs are in a state of deficiency or excess, the qi and blood are prosperous or on the decline, the nature of the disease is a cold or heat type, and the severity of the disease and its prognosis. All of these combined can lead to a conclusion about whether a person is healthy. Diagnosis through inspecting the complexion is mainly carried out by observing the changes in the color and radiance of the facial skin. When looking at a person's complexion, it is important to compare the color during illness with its normal color and compare the patient's skin color with that of a group of peoples to arrive at a judgment. Second, observe the change in the radiance of the skin color. When a change occurs in the pathological development, the radiance of the facial skin changes. Third, judgment should be primarily based on the general complexion of the patient, but its radiance and moistness or dullness constitute the key basis for judgment. In addition, face reading should not be confounded by factors unrelated to diseases. For example, no face reading should be conducted right after physical exercise. There are mainly 4 types of complexions, but we shall only discuss the first 2. Red complexion. When the facial skin is red, it generally indicates that there is heat in the body. Qi and blood flow smoothly when they are warm. When heat is abundant and blood vessels are full, the color of the blood is reflected in the skin, making the face red. When accompanied by a red swelling and sore throat, it indicates exogenous wind heat attack, that is, wind and heat combined invading the human body. A very red edge of the face indicates heat in the Yang-Ming meridian, one of the 12 principal meridians of the human body. Heat in the Yang-Ming meridian refers to the exuberance of heat pathogens pervading the Yang-Ming meridian. When accompanied by insomnia or irritability with hot sensation in the chest, palms, and soles, it indicates endogenous heat due to yin deficiency. Yin is only deficient when compared with the normal state of yang because when yin, which is cold in property, is insufficient, yang, hot in property, becomes excess as a result, and a general relative heat condition is established. A pale complexion with redness in cheekbones, accompanied by shortness of breath, limbs cold up to the elbows and knees, indicates long-term illness leading to yang deficiency and yin exuberance, that is, excess of internal yin leading to damage of yang. White complexion. When a person's complexion lacks the color of blood, this person is considered to have a white complexion because the lack of blood results in the failure of nutritive blood to nourish the face. White mainly indicates a deficient cold syndrome and a syndrome of blood deficiency, which are the result of the deficiency of both qi and blood, leading to failed nourishment of the body. Pale complexion, weight loss, and lightheadedness indicate an internal blood deficiency. That is, there is not sufficient amount of blood in the body to fully nourish Zhang and Fu organs, the meridians and collaterals, and the physical shape, nor can it sustain the normal mental activity of a human being. Dullness in the complexion and general malaise indicate the decline of yang. A pale complexion and severe abdominal pain indicate internal hyperactivity of cold, that is, pathogenic cold, invading the body and damaging yang, which leads to retention of pathogenic cold in the body. Pale complexion, profuse perspiration but feeling cold, and limbs cold up to the elbows and knees indicate a sudden depletion of yang in the body, or what we call yang deficiency. Thank you for your attention.
Let's discuss interviewing. Excessive dreaming patterns 1 of 2. First, the liver fire. Excessive dreaming, nightmares, restless sleep, headache, red face, dizziness, tinnitus, irritability, propensity to outburst of anger, thirst, bitter taste, constipation, dark urine, red tongue with redder sides and dry yellow coating, wiry rapid pulse. Letter B, heart fire, excessive dreaming, restless sleep. There's mental restlessness, feeling agitated, insomnia, palpitation, thirst, mouth and tongue ulcers, feeling of heat, red face, bitter taste, red tongue with redder teeth, and a yellow coating, overflowing rapid pulse. Letter C, phlegm, fire harassing the heart. There is excessive dreaming, restless sleep, insomnia, waking up from nightmares, mental restlessness, agitation, mental confusion, palpitation, thirst, red face, feeling of oppression of the chest, dark urine, expectoration of phlegm, bitter taste, insomnia, red tongue with redder swollen tip, heart cracks with a sticky yellow coating inside it, slippery rapid or slippery overflowing rapid pulse. Letter D, phlegm, fire in the stomach. There is excessive dreaming, restless sleep, insomnia, mental restlessness, burning epigastric pain, thirst without a desire to drink, bleeding gums, dry stools, dry mouth, mouth ulcers, sour regurgitation, nausea, vomiting soon after eating, excessive hunger, foul breath, feeling of heat, feeling of oppression of the chest and epigastrium, mucus in the stools, expectoration of phlegm, red tongue with sticky yellow coating, stomach crack with a rough sticky yellow coating inside it, slippery rapid and slippery overflowing pulse. Letter E, heart yin deficiency with empty heat. There's a dream disturbed sleep, dreams not too agitated, poor memory, anxiety, propensity to be startled, mental restlessness, uneasiness, feeling hot and bothered, palpitation, dry mouth and throat, thirst with a desire to sip fluids, feeling of heat in the evening, muller flush, night sweating, five palm heat, red tongue with redder on the tip, no coating, floating empty and rapid pulse. Letter F, liver yin deficiency with empty heat. There's a dream disturbed sleep, insomnia, depression, feeling of aimlessness, dizziness, numbness of the limbs, blurred vision, floaters in the eyes, dry eyes, diminished night vision, scanty menstruation or amenorrhea, dull pale complexion without spirit, but with red cheekbones, muscular weakness, cramps, withered and brittle nails, very dry hair and skin, feeling of heat in the evening, night sweating, five palm heat, thirst with the desire to sip fluids, red tongue without coating, floating empty and slightly rapid pulse. Letter G, heart and kidney and deficiency with empty heat. Dream disturbed sleep, palpitation, mental restlessness, insomnia, anxiety, poor memory, dizziness, tinnitus, deafness, excuse, backache, nocturnal emission with dreams, feeling of heat in the evening, night, night sweating, five palm heat, scanty dark urine, dry stools, red tongue with redder tip without coating, midline heart crack, floating empty and rapid pulse or deep wake on both rear positions and relatively overflowing on both front positions. Thank you for your attention.
We continue with the five-phase therapeutics. We now discuss the mother-son point combinations for deficiency and excess conditions of the yang channels. For the large intestine channel, for deficiency condition, we can use Li11, the earth of the metal channel, as the affected channel, and then the mother-son channel would be stomach 36. For excess, Li2, water of the metal channel for the affected channel, and the mother-son channel, which is bladder 66, the water of the water channel. For small intestine, deficiency condition, SI3 for the affected channel, and GB41 for the mother-son channel. For excess small intestine, SI8 affected channel, the mother or son points, and then we have stomach 36 for the mother-son channel. For Sanjiao deficiency, we use Sanjiao 3 on the affected channel, and bladder 41 for the mother-son channel. For excess Sanjiao, we have Sanjiao 10 on the affected channel, and then stomach 36 for the mother-son channel. For the stomach deficiency conditions, we use stomach 41, which is actually the fire of the earth channel. On the affected channel, and for the mother-son channel, we use SI5, the fire of the fire channel. And for excess stomach, we use stomach 45, the metal of the earth channel, and the LI1 for the mother-son channel. For urinary bladder deficiency, we use bladder 67 on the affected channel and LI1 on the mother-son channel. For excess urinary bladder, bladder 65 on the affected channel and bladder 41 on the mother-son channel. And finally, for the gallbladder deficiency, we use bladder 43 on the affected channel, and for the mother-son channel, bladder 66. For excess gallbladder, we use bladder 38, which is the fire of the wood channel, and SI5, the fire of the fire channel, on the mother-son channel. Thank you for your attention.
Let's now proceed to the differential diagnosis in Western and Chinese medicine with acne and acne rosacea. First, we have the Western differentiation. Common acne is defined as a dermatological condition affecting glands in the skin, which secretes sebum. Acne tends to develop around the areas densely supplied with sebaceous glands, such as the face, upper chest, and back. The common causes of acne are, first, puberty, where boys and girls have an increased sensitivity to testosterone. Second is genetic factors. So acne can run in families, making certain people more likely to have it. Third is polycystic ovarian syndrome. Acne with abnormal menstruation, amenorrhea, weight gain or obesity, insulin resistance or diabetes, infertility, hirsutism, decreased breast size. Other causes include hormonal changes related to menstrual periods, pregnancy, contraceptive pills, certain drugs like corticosteroids, anabolic steroids, and high levels of sweating and humidity and stress. Okay. Acne rosacea is a chronic skin condition involving inflammation of the cheeks, nose, chin, forehead, or eyelids. Manifests as redness, prominent spider-like blood vessels, swelling, or skin eruptions similar to acne. The causes of acne rosacea in Western medicine is unknown, but it is more likely to develop if a person is of fair-skinned female, although men develop a more severe form, and prone to blushing in between the ages of 30 and 50. Now let's proceed to the Chinese differentiation of acne and acne rosacea. Let's start with diagnostic questioning according to organ relationship. So when we ask about the stomach and intestines, or the Yangmin, about the lung and the stomach, the internal channel pathway. Next is we should consider the age for heat in the lungs, heat with heat toxin in younger people, heat at blood level with stasis, which is late onset in women. Next to consider is location and the type of acne. If there are lesions on the forehead and nose, it will indicate heat in the lung. If the lesions around the mouth, on chest, and the upper back, it will indicate heat in the stomach. And if the lesions affect are affecting the nose, mouth, in between the eyebrows, it will be heat at the blood aspect. Painful lesions with erythema on upper back and chest, it will indicate heat toxin. Deep, painful, inflamed nodules in the face, chest, and back, it indicates damp toxin with blood stasis. Cystic lesions indicates phlegm. The degree of redness denotes the degree of heat. The duration cyst and scarring, more blood stasis and phlegm. Acne rosacea is empty heat. For the etiology, we can trace it to emotional stress like anger, frustration, resentment, and also to diet, eating high fat, spicy, and greasy diet. And it can also be due to external toxins, which is a combination with internal heat, or it could be traced to pre-existing dampness combining with external toxins. It could also be due to yin-yang imbalance in menstrual cycle and coming off contraceptive pills. Underlying patterns, Ren and Chong, are not regulated, and there is heat in the Yangming. For the Sangfu organ patterns, can be due to wind heat invading the lung channels of the face, lung and stomach heat, or fire with heat toxin. It could also be due to intestine, stomach heat, heat toxins, or it could be due to of phlegm with blood stasis or pure attention.
Let's discuss the liver relationships to other organs and tissues. First, the tendons, the outward manifestation in the nails. The tendons attach to the bones and gather at the joints. They link together the joints and the muscles, and they aid in controlling movement. The liver controlling the tendons means that the relaxation or contraction of all the tendons in the body is related to liver function. In CM, the liver is the source of nutrients for the tendons. If liver blood is full, then the tendons are nourished. This strengthens them so they can act forcefully and the joints can flex and extend with ease. The plain question states, having received blood, the feet can walk. Having received blood, the palms can hold. Having received blood, the fingers can grasp. If liver blood is insufficient, the tendons lose their nourishment. This can impair the limb's ability to flex or extend and cause spasm in the tendons and tremors in the hands and the feet. If there is severe injury to liver and liver blood, there may be tetany in the limbs, opisthotonus, and stiffness in the neck. This is known as liver wind stirring in the interior. Hence, the plain question states, all syndromes of shaking, dizziness, and vertigo belong to the liver. It is also said, the liver is the Zhang organ of wind and wood. The liver controls the functions of the tendons, and a person's ability to move involves the tendons. These facts have led to another saying, the liver is the source of stamina. Stamina refers to capacity to resist fatigue. Since the liver stores blood and is the control over the tendons, it is also the source of the body's capacity for motion. The nails include both fingernails and toenails. In CM, the nails are external extension of tendons, hence the saying, the nails are the surplus of the tendons. The status of the liver blood is often reflected in the nails. When liver blood is adequate, the nails are well nourished and are strong, bright, and lustrous. When liver blood is insufficient, the nails lose their nourishment and are pale, thin and soft, lusterless, easily deformed, and brittle. Therefore, diseases affecting the nails are usually treated by methods for treating the liver. Opening into the eyes. The liver meridians link with the eye system. Visual acuity and eyesight depend upon nourishment by liver blood. The plain question states, Having received blood, the eye can see. The spirit pivot also states, liver chi reaches the eyes. When the liver is in harmony, the eyes can distinguish the five colors. Because of the close relationship between the liver and the eyes, the physiological and pathological states of the liver can be reflected in the eyes. For example, deficiency of liver yin or liver blood may lead to blurred or impaired vision. Dry and scratchy eyes and night blindness. Flaming up of liver fire may lead to painful inflammation of the eyes. Dampness heat in the liver may lead to jaundice and other symptoms. Though the eyes are the windows for the liver, the essential chi of all Zhang and Fu viscera can flow into them so that they all have connection with the eyes. These various connections have all been corroborated in clinical practice. Thank you for your attention.
Let's discuss diagnosis according to Sangfu organ patterns, heart fire. Excess heat will agitate Shen, and this is reflected in the symptoms and signs which will be pronounced. In this pattern, Shen is not blocked or smothered in the same manner as it is in phlegm heat agitating the heart. So there will not be the same mental confusion, blurred thinking, and poor sense of reality. It is also important to differentiate this pattern from heart yin deficiency heat. The symptoms of this pattern will be much more pronounced. When there is excess heat, there will be mania and mental agitation rather than just mental restlessness. Heart yin deficiency pulse will be weaker. Heat from the heart can drain downwards to the urinary bladder via the small intestine and creates symptoms of heat in the urinary bladder, such as burning pain when urinating and blood in the urine. Etiology: excessive consumption of energetically hot food. Medicines and beverages will generate fire in the body, as will invasion of exogenous evil chi stagnation, and phlegm stagnation. Fire and heat from other signs can rise up to the heart due to the young nature of heat agitating the heart. Long-term and powerful emotional imbalances can eventually lead to heart chi stagnation that can create heat in the heart. Symptoms and signs: there is insomnia, dream-disturbed sleep, red face, mental unrest and unease, mental physical agitation, mania, aggression, both verbal and physical, irritability, rapid body movements, difficulty sitting still and being settled, talking a lot and talking quickly. The person is very easy to connect with but has a tendency to give you too much and irrelevant information. There's palpitation, physical unease in the chest, tongue ulcers, dark urine or blood in the urine, burning pain or on urination, uncontrolled laughing, laughs while talking, talks to themselves, difficulty maintaining eye contact because the eyes constantly dart about. There is thirst, bitter or metallic taste in the mouth, insomnia, rapid breathing, red tongue with red swollen teeth, dry yellow tongue coating. There may be ulcers on the tongue. The pulse can be rapid and flooding or skipping. For the key symptoms, there is red face, palpitation, talks quickly, ebullience, thirst, bitter taste, and red tongue. For the treatment principle, we have to drain heart fire and calm the Shen. Acupuncture points: choose from pericardium 6, pericardium 7, pericardium 8, heart 8, heart 9, REN 15, do 14, do 20, do 24, UB 15, and kidney 1. Needle technique is draining technique. Even technique on kidney 1. For the explanation, pericardium 6, pericardium 7, pericardium 8, heart 8, heart 9, REN 15, UB 15, drain fire from the heart and calm the Shen. Do 14 drains heat, do 20 and do 24 calm Shen. Kidney 1 drains fire downwards, tonifies kidney water, and calms the shen. Relevant advice: the patient should avoid all food and beverages that create heat. This will include things such as alcohol, lamb, chili, and other hot spices, deep-fried foods, dark chocolate, garlic, and so on. The heart is already overstimulated in this pattern, and therefore it should not be further stimulated. This means that coffee, black and green tea, and anything that contains caffeine or other stimulants must be avoided. Heart fire can be caused by the following pattern: heart chi stagnation, liver fire, stomach fire, blood heat. Heart fire can result in the following pattern: phlegm heat agitating the heart blood stagnation, heart gene deficiency, kidney yin deficiency, liver fire, stomach fire. For the summary: heart fire blazing, the etiology, chronic anxiety, worry, anger. Underlying pathology, there is liver fire blazing. For the signs and symptoms, there is mental restlessness, agitation, insomnia, mouth ulcers, red face, thirst, yellow urine, dry stool, spontaneous external bleeding, manic agitation, delirious speech, sweating, red swollen, and painful skin sores. Pulse, there is rapid and overflowing, especially on heart position. Tongue, red with redder thick and yellow coating. Treatment principle is to clear the heart and drain the fire. Acupuncture treatment to clear heart fire, needle heart 8, pericardium 8, heart 9, ren 14, prick to bleed pericardium 9, and heart 9. Select points based on symptomatology. For mouth sores, use kidney 2. For agitation and mental restlessness, use kidney 1, pericardium 5. For insomnia, use heart 7, bladder 15, heart 5. For thirst, use sanjiao 2, ren 23, kidney 6, spleen 6. For dry stool, use liver li4, li11, stomach 37, sanjiao 6. For bleeding, use stomach 44 and pericardium 4. Thank you for your attention.
Etiology in
Let's now
Chinese medicine. This time we talk about wind. Wind is a dominant climatic factor in spring, but is present in all 4 seasons. Hence, although wind-induced illnesses are most common in spring, they can be seen in other seasons as well. In Chinese medicine, the wind evil is a very important cause of illnesses due to exogenous factors. The nature and pathogenic characteristics of wind are as follows. So here you could see that this is so fast moving, as you can see, and then we have external wind that is characterized by impaired resistance and metabolism, physical and chemical factors, and this would also include bacteria and virus. And the impact of exterior wind evil will, when it attacks the upper body, will result in headache, sweating, stuffy and running nose, puffy face, itchy throat. Okay, so it can because it affects the upper body, therefore it has the characteristic of being able to ascend, permeate, and externalize. Exterior wind evil can loosen skin and interstitial space, leading to fever, and this will be manifest as fever, aversion to wind, and sweating. Exterior wind evil is characterized as being movable, and this gives rise to migratory arthritic joint pain. And lastly, it is changeable or transformable. So, and this can be this can lead to rubella, urticaria, or eczema. So, if one has liver dysfunction, definitely there will be interior wind, and this can have 3 impacts. Like it causes extreme inner heat, causing wind, transformation of liver yang into wind, and blood deficiency causing wind. Wind is a yang evil. Its nature is to open and permeate, and it has great ability to invade the yang sites in the body. Wind evil is swift and does not rest. Its characteristics are to rise, to permeate, and to move outward. Hence, it is a yang evil. The opening and permeating ability of wind means that it can easily penetrate the skin and enter the interstices. It often attacks the head, the yang meridians, and the superficies, and it often induces headache, sweating, aversion to wind. Wind is mobile and changeable. Wind being mobile means that when causing disease, it can move quickly from side to side without being tied to anyone. For example, in rheumatic and rheumatoid arthritis induced by wind, cold, and dampness, migratory pain of the joints is a symptom of wind. Because of this, the condition is often called migratory rheumatism or wind rheumatism. Wind being changeable means that diseases it induces are fast-changing and unpredictable. For example, wind-induced urticaria, hives, is characterized by wheals that are itchy and evanescent and that can appear unpredictably in different areas. Wind is the chief of all illnesses, according to Plain Questions. It is the most important of the climatic pathogenic evils, since the other climatic pathogenic evils all invade the body with its help, as in illnesses caused by wind cold or wind heat or wind dampness. Thus, wind is often the vanguard for the other external pathogenic evils. Indeed, ancient physicians even used wind as a general name for external causes of illness. Thank you for your attention.
Let's discuss the emotions. Anger. The term anger, perhaps more than any other emotions, should be interpreted broadly to include several other allied emotional states, such as resentment, repressed anger, feeling aggrieved, frustrations, irritation, rage, indignation, animosity, or bitterness. If they persist for a long time, any of these emotional states can affect the liver, causing stagnation of liver qi, stasis of liver blood, rising of liver yang, or blazing of liver fire. Anger, intended in the broad sense outlined above, usually makes qi rise, and many of the symptoms and signs will manifest in the head and neck, such as headaches, tinnitus, dizziness, red blotches on the front part of the neck, and a red face, thirst, a bitter taste, and a red tongue with red sides. So we have here a clinical picture of anger. So there is a tense shoulder, dizziness, tinnitus, dry throat, shouting, blurred vision, wiry pulse. Chapter 8 of the Spiritual Axis says, anger causes loss of self-control. The Simple Question, chapter 39, says, anger makes qi rise and causes vomiting of blood and diarrhea. It causes vomiting of blood because it makes liver qi and liver fire rise, and diarrhea because it includes liver qi to invade the spleen. Chapter 3 of the Simple Question says, severe anger severes the body and qi. Blood stagnates in the upper part of the person, may suffer from syncope. The effect of anger on the liver depends on the one hand on the person's reaction to the emotional stimulus, and on the other hand on other concurrent factors. If the anger is bottled up, it will cause stagnation of liver qi, whereas if it is expressed, it will cause liver yang rising or liver fire blazing. In a woman, stagnation of liver qi may easily lead to stasis of liver blood. If the person also suffers from some kidney deficiency, perhaps from overwork, then he or she will develop liver yang rising. If, on the other hand, the person has a tendency to heat, perhaps from excessive consumption of hot foods, then he or she will tend to develop liver fire blazing. So this is the illustration of the effects of anger. So anger can affect the heart, When it affects the liver, there is liver yang rising or liver qi stagnation. It also affects the stomach and also the intestines. Anger does not always manifest outwardly with outbursts of anger, irritability, shouting, red face, etc. Some individuals may carry anger inside them for years without even manifesting it. In particular, long-standing depression may be due to repressed anger or resentment. Because the person is very depressed, he or she may look very subdued and pale, walk slowly, and speak with a low voice, all signs which one would associate with the depletion of qi and blood deriving from sadness or grief. However, when anger rather than sadness is the cause of disease, the pulse and tongue will clearly show it. The pulse will be full and wiry, and the tongue will be red with redder sides and with a dry yellow coating. This type of depression is most probably due to the long-standing resentment often harbored towards a member of that person's family. Thank you for your attention.